In the heart of Africa, where malaria is serious but access to healthcare is limited, there's a story of success. Welcome to Zambia, a country bigger than France but with a much smaller population. People in rural areas are at greater risk of malaria infection, but distances to healthcare facilities can be very far. So how do we bridge the gap? How do we bring healthcare closer to those who need it the most? More than a decade ago, the Ministry of Health, through the National Malaria Elimination Program, introduced a system to test, treat, and track malaria beyond the health facility. It has grown into a nationwide network of trained health workers, now more than 20,000 strong, of individuals chosen by their communities. This approach brings to life the mission of the Ministry of Health to provide equitable access to cost-effective quality healthcare services as close to the family as possible. Hi, my name is Lucy, and I'm a community health worker. Welcome to my village. When someone in the community is not feeling well, they come to me and I quickly test for malaria with a simple finger prick. If the test shows malaria, I give the patient medicine right away. If the test is negative, I refer them to the health facility because they are still unwell. In areas with lower cases of malaria, like my village, my work doesn't end with confirmed cases of malaria. In fact, my work is just beginning because I need to follow up at the patient's home and in their neighborhoods and test there too. Why? Because infections tend to happen in clusters. Remember, malaria spreads from person to person through the bite of an infected mosquito. If I find anyone with malaria during my rounds, I give medicine to cure them. The people in my community trust me because I'm trained and equipped to provide life-saving health services. I also share information on how to prevent malaria and other diseases. I keep a record of every person I test, treat, and refer. Every month, all the community health workers in our area gather at the health facility to restock our supplies, review our data, and send the information into the national health system. This ensures that the data we collect is accurate, timely, and complete. A near real-time picture of the local malaria situation. Officers at all levels of the healthcare system use this information to understand malaria patterns and to make informed decisions. I am proud to serve my community. By catching malaria infections early, we prevent malaria from spreading, resulting in fewer cases and fewer lives lost. We can see this in the data. More importantly, we can see it in our communities, where people are healthy, going to school and to work free of malaria. Malaria is a deadly disease that can quickly become serious. If you suspect you have it, headache, fever, chills, joint pain, nausea, go for immediate testing to your community health worker or to the nearest health facility. If you test positive, complete the full course of the correct malaria medicine. Pregnant women should go to antenatal early for preventative medicine against malaria, and for everyone to sleep under a treated mosquito net every night. Remember, malaria ends with me. Malaria ends with you. Together, we can end malaria for good.